Why are prescription drugs so much more expensive in the United States than they are in Canada, Germany, or almost any other developed country? It didn't happen by accident. It happened because Congress wrote laws that gave pharmaceutical corporations extraordinary power and denied that same power to the American people. The first was the Bayh-Dole Act of 1980. American taxpayers spend billions of dollars funding medical research through institutions like the National Institutes of Health and others. We fund the universities, we fund the laboratories, we fund the scientists who discover new drug targets, new treatments, and sometimes the drugs themselves. But under Bayh-Dole, institutions receiving federal research dollars can patent those publicly funded inventions and then license them exclusively to private companies who can charge us whatever they want. The public pays for the science, then a corporation gets control of the patent. Then the same public is charged monopoly prices to receive the medicine we helped create. The law supposedly gave the government what's called march-in rights, power to require additional licensing, thereby creating competition and lower prices when the public interest demanded it. But in more than 40 years, the federal government has never once used that power. Tell me how that's not abandoning the American people. Then came the Medicare Modernization Act of 2003. Congress created Medicare prescription drug coverage, but included a provision explicitly preventing the federal government from directly negotiating drug prices, unlike the rest of the developed world. Think about that. Medicare became one of the largest purchasers of medicine on the planet, but Congress prohibited it from using that purchasing power to demand a fair price. Private insurance companies could negotiate, pharmacy benefit corporations could negotiate, but drug manufacturers could set their prices and charge whatever they wanted, and only the U.S. government had to pay whatever they asked. The American people, acting together through our own government, were told to stand down and pay their bill. And that restriction has now been partially reversed. Medicare negotiated prices for its first 10 drugs beginning in 2026. And what happened? The negotiated prices were 38 to 79% below the drug's list prices. Medicare estimated billions of dollars in savings. Negotiation works. The pharmaceutical industry knew it would work. That's why they fought so hard to prevent it. In 2003, as Congress was writing the law prohibiting Medicare from negotiating directly, the drug industry spent more than $100 million lobbying Washington and deployed 824 lobbyists, almost 2 for every member of Congress. Add the insurance companies and allied interests, and nearly 1,000 lobbyists were working the bill. Half of them had previously worked in Congress, the White House, or the executive branch. Then, when Congress tried again to authorize negotiation in 2021, the pharmaceutical and health products industry deployed roughly 1,600 lobbyists, 3 for every member of Congress. PHRMA and its allies also spent tens of millions of dollars on advertising against the proposal. This wasn't an academic policy disagreement. There were billions of dollars in monopoly profits at stake. They invested millions in influencing Congress so they could continue charging the American people billions more. Across the market, Americans pay nearly 3 times what people in comparable countries pay for the same medicines. For brand-name drugs, the difference is even greater. Some products, including insulin, have cost Americans 5 or 10 times as much as the same drug costs elsewhere. Now, Canada controls excessive patented drug prices and negotiates collectively. Germany evaluates whether a new drug actually provides additional benefit and negotiates its price accordingly. Only here in America has Congress chosen to protect the monopoly, throw up its hands, and send you the bill. I believe in rewarding genuine medical innovation, but taxpayers should not finance the research, guarantee the market, protect the patent, and then be financially punished when we become sick. Public investment must create public benefit. Medicare should be empowered to negotiate every excessively priced drug, not merely a handful. Patent manipulation that delays affordable generics has got to end. And when taxpayer-funded inventions are withheld from the public through abusive pricing, then Congress must use its licensing authority to empower competition for public benefit. Medicine should heal people. It should be available to anyone who needs it, our sick, our disabled, our elderly, our children in poverty, anyone. Our money discovered these drugs. We deserve to benefit. Right now, Congress has allowed medicine to become a mechanism from extracting everything a frightened, sick, or dying family has left. Congress created the system. Congress can change it, and I'm committed to changing this for the better. Care, courage, the Constitution. Vote Melissa for Congress.